Are you one of the millions who suffer from bleeding gums or chronic bad breath? Now there's a new and effective treatment for gum disease, Perio Protect.
Now I've been working on this idea for like 26 years of how we could find a way to deliver these medicaments in a safe, reliable way. We used to use syringes, we put medications on floss, we've had all sorts of different avenues of doing this, but I needed something that was easy, that was simple, that anybody could do it. And that's what these special trays are. What they are is they're a tray that have a special seal that directs the medications to go in between the teeth and down under the gum tissue so that you can overcome the curvicular flow. And one of the situations you have in this little valley, you have a continuous exudate of fluid, and one of the problems that we have had is that we can put anything in there, but it only lasts for about a minute or two, and the body flushes it out. And what these trays do, they allow us then to put something in there and hold it in there.
Within days of using the Perio trays, patients will see results and infections will heal. Symptoms of gum disease include red and swollen gums, bleeding gums, chronic bad breath, loose teeth, and gum recession.
What we're finding is that gum disease is a progressive disease, plus gum disease does not stay locally oriented. One of the first things that a patient is told by a physician, say they're going to get a knee replacement or an artificial joint, go to your dentist to get all the oral bacteria taken care of. The physicians have known for years that this is a portal of entry for bacteria. They're finding them in arteries, they're finding them in the bacteria in the blood clots in arteries, they're finding the bacteria in heart valves.
According to the 2003 World Health Organization, more than 90% of the U.S. population between 35 and 44 years old have some form of gum disease. The Perio trays are many times covered by your dental and medical insurance.
The cost on this is very reasonable, and I've actually had my medical insurance has picked up some of this because the infection that I had from the gum disease was dangerous to my health.
The medications are placed by the patient in the tray, then they insert it over their teeth. And because you have this seal around the periphery of all the teeth, it actually guides the medication between the teeth and up under the gum tissue. And when the patient bites on it, you can actually watch the little bubbles go right up under the gum tissue, and when they let off, it just comes right back. So it's almost like a very gentle little mechanical pump to actually hold the medications up in between the teeth, up under the gum tissue.
I was really impressed at how simple the idea is and how easy it is to do and how good the results are. It just seems pretty obvious. After you learn about it, it's kind of like, well, that's kind of a good idea. I wonder why somebody didn't think of that sooner.
Actually attended a seminar that Dr. Keller had put on. Of course, he's the developer of the treatment system, and right after the FDA had cleared it for use by the rest of the dental community, that's when we attended and began using it with our patients.
I needed a Perio Protect because I had severe bleeding and some inflammation in my gums. So I came to see Dr. Keller, and at that point he told me that I had periodontal disease, something I had never heard of prior to that. My results have been astounding, quite frankly. My bleeding has gone away completely.
I would recommend the trays and have to some of the people that I've already talked to that have gum problems and don't understand what it is and have been told some of the same things I have, that you have to have your teeth pulled and you have to have all of this surgery and that implants are the only answer, and this is an option.
This is an adjunct that is necessary and important. Again, knowing that antibiotics can help. I don't want to give people pills to try to treat something that's in their big toe. I'm looking at keeping it right around the teeth where the infection's at. This is a system that allows me to do that. The first time I heard about Perio Protect, I figured that this was something that was going to work for us.
The patient's response is excellent because the patients can feel it working.
You can truly feel a difference.
This process has been clinically shown to be comfortable, easy, effective, and reliable. Go to www.perioprotect.com to find a dentist in your area.